My name is Ivan Browne and I'm the Director of Public Health for Leicester City Council, and I'm also an honorary professor with Montfort University. Well, under normal circumstances, my duties are really around population health. What is it that we need to move our population's health forward? So I get involved with things like weight management programs, cardiovascular disease, respiratory, stop smoking, physical activity, all the things that are about improving people's health and well-being. But also another strand of my job is around communicable diseases. So right now, my main job is really very much around COVID and the management of COVID in the city and trying to minimise the impact of COVID. I mean, it has been, as you said, a really difficult situation for the city. I mean, I think that we know that we were the first city to be put into a local lockdown, perhaps the only city that's been put into a local lockdown, really. And so the people of Leicester have had to respond more than anywhere else in the country in relation to COVID. And I suppose my reflections of that are, first of all, around the tenacity of this city. I am a city resident. I was born in the city, but I think I've only really had a true understanding of just how resilient the city has been over the course of this. So it's been a tough time, but I feel that we have managed to get through it collectively. I think, like the rest of the country, the vaccine rollout has been great. We knew that all the time we were, in a sense, with all of our measures, trying to buy some time until we had a solution, which is the vaccine. So the rollout has gone very, very well, particularly going down the age groups. But of course, we are a younger city, including students that are at this university. So we're at the point now where we're trying to vaccinate that younger population, and we really need them to take that opportunity of getting vaccinated to protect themselves and to protect others. So the programme's going well, and we want it to continue to go well. Right, so I think there are a few groups that are like that. I've mentioned young people, and I think that's reasonable, that younger people are less likely to take it up, or we've seen some being less likely to take it up. And that's because really young people are reflecting, and they're thinking, well, actually, we're not at the highest risk, we're not the people that end up in hospital, we're not the people that are most vulnerable to death or those outcomes. But actually, it's still a really horrible illness, and it still requires people to protect themselves and protect others. The other groups that we've also seen have been some people from the black community. They have also been resistant to it, and I think that's born around a lot of things. I think it's got a lot of issues around let's just wait and see. So people are looking and they're seeing what's happening, first of all. And some of this is born in trust, because sometimes some of our bigger institutions have not necessarily served the interests of black people particularly well. So I think they're cautious around that, and they want to see what happens around it. But we continue to work, we continue to provide information around that, and really try to pick on some of the disinformation that's out there as well, that's probably affecting people's decisions. I think the way to get those groups to respond, or my experiences of getting those communities, those groups to respond, is to talk to people. Not the kind of general bland messages that we might get, or national messages that we get, but actually doing things like this. People have got genuine questions. They want to ask. They're not being hostile. They just want to know. And so we've had, webinars. We've had opportunities to just do Q&As, etc. And those are the things where you connect, because people's experiences are different, and you have to reflect that in the conversations that you're having. So I really welcome opportunities like this to have those conversations and say, okay, what's the things that you're worried about? Some of those concerns may be valid, a lot of them may not be valid, and people just want that assurance, which is completely reasonable when it comes to their health. I have said that we are battling two pandemics, the virus itself and also the virus of misinformation. And I think this is the first time that we've seen at this level of scale how misinformation can get out there. So I remember misinformation keeps changing. I remember when people were saying, if you have the vaccine, it will kill you. We've had millions of doses across the entire world at this stage, and that has not been the case. So then people will use things like, long-term effects in relation to vaccination. Even though every vaccine that we've ever had, vaccines are probably the safest form of medication that is out there. We have never seen long-term effects related to vaccination. So there is absolutely no reason to assume that there will be something related to this one. Issues around fertility, all kinds of things that have been out there. And what I'd ask people is just, let's have a look at the information that's out there. Go to trusted sources. It's not about not questioning. They're all valid questions, but please listen to answers where there is some kind of responsibility that goes with the answer. The problem with social media and some of those other areas is if they have it wrong, there is no responsibility. You can't find the person that said that or the evidence that they used to say that. There is no comeback. But if you use trusted sources, of course you can hold people to account in relation to it. So I think it's really important that people use those information sources wisely and not count all information as good information. This is it. I mean, we are seeing those larger events. Remember that some of those larger events, I think of Leicester City and the FA Cup, I cannot tell you the amount of work that we did in order to make sure that everybody was tested, making sure that everybody travelled safely, all of those things. So they look great on TV, but actually there was a shed load of work that went in the background to make sure that they were kept safe. So I think it's really important for you to still have your vaccine because, yes, you might be fine, but equally, you know, we've got other issues that we have to factor in. So we've got things such as long COVID, and some of you will have friends that have experienced COVID and they are still not back and they are still not recovered. And also this issue around transmission as well. So what we're trying to do is we're trying to break the opportunities for transmission. We know that whilst it doesn't stop transmission, it reduces the level of transmission to people who may be more vulnerable. But also the key thing is we're trying to get the virus out of circulation. Because you have all seen that every time that the virus is out there and it's circulating, it gets an opportunity, that increases the risk of variants. The risk of variants means that we are at greater risk of things not going well in relation to vaccine coverage, etc. So it's really important that you continue to play your part so that we can get back to that normal life. So you can go back to, you know, meeting up with friends, going on holiday together, going out in the evenings together without feeling that there is an inherent risk that you're having to balance to do that. So I think that's a really interesting one. And people have spoken a lot about variants and vaccine escape. But I think let's just look at the information that we've got. So we've had what was called the Kent variant at the time, and the vaccine still worked against that. Even with Delta, as the information has emerged, they're still on what we call the S gene. They are still working. So the vaccines are working, even with those variants. But, you know, it's really important that we don't push our luck. It's really important that we don't just say, well, it's all going to be fine. We want to make sure that we are reducing those opportunities for transmission, reducing those opportunities for the vaccine to you know, push and shove to see whether it, you know, if I adapt in this way, whether it will work. So if we do that, then the risk that comes from variants diminishes. So that's why it's still really important to get vaccinated at this time, even though the vaccines that we have are effective, particularly if we have that double dose. That's absolutely key that we have our, you know, both doses of vaccine. Absolutely, we are a university city, whether it's de Montfort or whether it's Leicester University or people that live in, you know, go to Loughborough still live in the city. So we have one of the youngest populations in the entire country. A lot of that due to universities, but a lot of that we're a gateway city and we have a lot of young people that sit with us. So it's absolutely key that our staff, that our students are vaccinated over and above, you know, other parts of the country where people may have come from. So the responsibility that sits with our younger populations here in the city are incredibly important. And as you know, given what Leicester has already been through, we just cannot bear, I mean, as a community, we do not want to be in those sorts of situations again where we're having restrictions or curtailment of our freedoms. So if we have a way that helps us to get out of that, we've got to take it for the sake of ourselves and for the sake of others. Right, so now as students, you are eligible. You know, you're over 18, you are eligible for your vaccine. And that means there's a number of ways that you can get hold of that. You can go, we've got a number of walk-in clinics that you can go to. Just go on the website, you'll find where those are and what they're offering. They're all offering either the Pfizer or the Moderna vaccine that's appropriate for your age. So you can do that, you can book online. So there's a whole range of ways. In the coming weeks, we want to really up those opportunities around walk-in vaccinations. And to be fair, when we did the surge vaccination a couple of weeks ago, students responded amazingly. I mean, we had people queuing, or students particularly queuing, all the way down from De Montfort Hall and other areas in order to receive their vaccine. So I think it's really important to say that students are being responsible. Lots and lots of students are already vaccinated and are awaiting their second vaccination. So what we're asking is that collectively, those that may be lagging in that, please come and join. Make sure that you're vaccinated too, so that we can get back to business as usual and get Leicester back into that normal and vibrant place to enjoy your university experience.